there was this report, Don't Treat Us as Outsiders. So it includes basically drug policies, drug prohibition, what it is, how it all started in the global north and how it afterwards came to the African region and the Southern African region. What are the global policies now, and also how civil society reacting to that? What are the services, health and social services for people who use drugs, and how is the debate around drug policy reform? And also the report includes a part where there are the voices of people who use drug in 5 different countries, where really the lived experiences of how it is to be a drug user in an African country. So in terms of opiate overdose per se, I think it is difficult to really have a sense of what is happening. Of course, you can have the information with peers, because peers are the one who see things happening. Peers are the one to experience things. But then in terms of when you want to look at policies and data to push things forward, there are some places where there is there is no national data about overdose. And I can use Mauritius as an example. When somebody dies from an overdose, on the death certificate, it is not written death from overdose. So there is no data, and it really makes things difficult, because if you want to push and really for policies to include or to take seriously the question of overdose, you need the data, and the data is not here. Okay, so with regards to naloxone, I haven't heard any country in the region that really has naloxone that is in the community. We've been hearing about health systems where they do have naloxone at the hospital, and I think we have enough documentation now to know that, okay, it's good to have naloxone basically in the hospital, but this is not basically where it should it cannot be limited to a hospital, because when there is a case of overdose happening, it is unlikely that people have it in the hospital, or sometimes where people are brought to the hospital, it can be too late. And also, I know there are situations like that in the region, where if you bring someone that's having an overdose to the hospital, then you can have a police case, because what are you doing there? What's your role in this? Are you the one who gave the person the product that he's overdosing on? Are you part of the deal? Are you also using? So of course this doesn't encourage people to bring their peers to hospital when there is a case of naloxone. But as far as I mean, I know that for example, we've been talking about the national drug plan that they are planning to do in Zimbabwe, and what civil society want to do now is to include it in the plan when the draft will go and be circulated among the different partners. But this is still like the beginning of the theoretical part, and then taking it from the theory to the practice is something else. As far as Mauritius is concerned, I think it's interesting to say now there is a section under the Prime Minister's office that is the National Drugs Secretariat, and then we have a drug master plan, which is called the National Drug Control Master Plan. And it's interesting because different civil society partners have been part of the drafting, and naloxone is part of the plan. Not only naloxone, but naloxone as being distributed in the community is part of the plan. But now we still need to see it going from the plan to the field. Like, we still have to see it happening. But I think it also is a major step that we have it written in a policy. Now it's all a matter of advocacy, of how well the advocacy is brought forward. But it's here. It's here. So it's interesting to mention that.